Today we will be presenting on Chapter 18 regarding exercise and its effects on the cardiopulmonary system. And this presentation is by Sydney, Victoria, and Caitlin. We're starting off are those objectives. The first one is to describe the effects of exercise on the cardiopulmonary system. The second one is to describe the interrelationships among muscle work's oxygen consumption and cardiac output. The next one is to discuss the effect of training on the heart and on cardiac output. The fourth one is to differentiate between stroke volume and heart rate and increasing the cardiac output. And the fifth one is to describe how body temperature and cutaneous blood flow relate to a number of symptoms collectively referred to as heat stroke. And the last one is to list all the benefits of pulmonary rehabilitation. So starting off are some ways that exercise can affect varying components of the cardiopulmonary system. The first one is control ventilation. The second one is oxygen consumption. The third one is arterial blood gas, ABG. The fourth one is oxygen diffusion capacity. The fifth one is alveolar arterial oxygen tension difference. And lastly, we have circulation. So first up, control ventilation. So when we exercise, our bodies will use more oxygen and produce more carbon dioxide. So you would expect that those levels would change in the blood, but it doesn't. And that is because of alveolar ventilation, which we will learn more about on the next slide. But that will increase enough to keep gas levels stable. So therefore, there are no known oxygen and carbon dioxide chemoreceptors on the venous side or the lungs that explain the increase. So it's unlikely that the O2 or CO2 will directly trigger increased breathing. So instead, there is a pathway that will show how the brain and body will send signals to ramp up ventilation. The first starts off with the cerebral cortex signals both the muscles to move and the medulla to breathe more deeply and rapidly. So this will boost the breathing. Next is the proprioceptors in muscles, joints, and tendons will send messages to the medulla via the spinal cord. The third one is higher body temperature during exercise also increases ventilation, which will stimulate breathing. And this photograph to the right demonstrates the three different parts of the pathway. Next up is alveolar ventilation. So we just briefly went over that, but when we are at rest, we're just sitting quietly. The average adult will exchange about 6 liters of oxygen or of air per minute. So when we're exercising, like running, cycling really hard, that can jump all the way to 120 liters per minute. So that is a 20-time increase. So there are two main reasons that alveolar ventilation must increase to in order to supply oxygen with blood for the muscles to use, and also to get rid of the excess CO2 that is being produced by the skeletal muscles. So now that the body increases ventilation mainly by breathing deeper, this is called tidal volume, as we know, during heavy exercise through both depth and rate will go up. Tidal volume during exercise is usually 60% of your vital capacity, and your breathing rate can reach up to 30 breaths per minute. So there are 3 stages of breathing during mild and moderate exercise. Keywords right there, mild and moderate. So this lovely diagram right here kind of demonstrates the 3 different phases. So at rest, as soon as you start exercising, your breathing increases almost immediately. This is your body preparing for the increased demand. So the alveolar ventilation will increase within seconds starting exercise. So the second part is the ventilation will continue to increase slowly or gradually over about 3 minutes or so. So this will follow a linear pattern within the level of exertion. So The increase is linear, meaning it goes up steadily depending on how hard you're working. The last stage is the ventilation will stabilize on once the body adapts to the exercise load. So once your body is adjusted to your level of exercise, your ventilation will then level off. So it will stabilize and then you reach a steady state of breathing. When you stop your exercising, your breathing doesn't just slowly stop. It will, your breathing does actually drop suddenly. It won't just slowly decrease. So that's the body realizing that it no longer needs this extra oxygen that it's been inhaling, or to also clear out as much CO2 as the body can. So continuing more with the alveolar ventilation, in a heavy exercise, something different happens, and that is that third phase that we just saw on this diagram to our left may not be seen. So when you hit around 60 to 70% of your maximum effort, your ventilation starts increasing even more rapidly, faster than your oxygen needs. And this will kind of lead to a buildup of lactic acid in your body. So that acid will be broken down by the hydrogen ions, which will stimulate the peripheral chemoreceptors in your body. So this diagram towards the right is kind of another stimulation to increase alveolar ventilation from chapter 9. So I kind of left off at the stimulation of the peripheral chemoreceptors. After that, it will stimulate the medullary inspiration neurons, and then that will then lead to an increase of alveolar ventilation. So oxygen consumption. When you're during heavy exercise, the maximum alveolar ventilation we generate is usually about 50 to 65% of the maximum voluntary ventilation, also called our maximum breathing capacity. So that means we still have a large reserve of extra ventilatory capacity that we don't even use. So this will be used to handle short bursts of intense effort, breathe more efficient high altitudes, and so on. Now we're going to talk about oxygen consumption. That was still going based off alveolar ventilation. So at rest, our skeletal muscles only use about 35 to 40% of the body's total oxygen consumption. That makes sense since we're not doing anything that will require major work. When you start exercising, that number will change. So during exercise or prolonged activity, the skeletal muscles can account for over 95% of the body's total oxygen consumption. So that means almost all the oxygen we're taking in is being used to support the muscle activity. So for untrained individuals, the oxygen consumption during heavy exercise can reach about 3,500 milliliters of oxygen per minute. And elite athletes, for example, if you're a marathon runner running a marathon, the oxygen consumption may exceed 5,000 milliliters of oxygen per minute. So if you look at this figure right here from chapter 18, you'll see that the oxygen consumption and the total ventilation will increase has a linear relationship as well. So that means the harder you work, the more strenuous your exercise is, the more increase in your ventilation you'll have. So next up is arterial blood gas during exercise. Oftentimes when you are in the hospital, you will have a ABG drawn, a arterial blood gas. And as we learned, that is oftentimes how they decide if you are in a alkalosis or acidosis state. Depending on your symptoms, will determine if it's metabolic or if it's respiratory. So in this instance, we are going to discuss your ABG during exercise. So from about 60 to 70% of your maximum oxygen consumption, your body actually does a good job of making sure everything's stable. During this, there's no significant changes in the oxygen level in your arterial blood, which is the PaO2, or the carbon dioxide level in your arterial blood, which is the PaCO2, or your pH between, like I just said, 60 to 70% of your max oxygen consumption. But during very heavy exercise, for example, that I keep using during a marathon, you have lactic acidosis develop. So that means since you're working harder, your lungs and blood are having to keep up, and you enter a anaerobic threshold, and so your muscles will start producing this lactic acid, and that will lead to you being in a acidosis state. So the pH will obviously drop, and your blood will be more acidic, and your CO2 in the arterial blood will also drop because your body responds by breathing faster, trying to blow off CO2. So the example I think of it to kind of help remind myself of this example is when we're breathing into a brown bag, and that mechanism behind, sure, it might calm you down, but also the CO2 that you're constantly breathing out is related to this in a way. So you're going to decrease CO2 due to the hyperventilation. So the oxygen in your arterial blood will remain constant, actually. So your oxygen levels won't really drop even during hard exercise in your arterial blood. This figure shows how the red arrow demonstrates your oxygen will just stay at this level of 98, 90, no, we'll go 98. And your CO2 in the arterial blood will kind of taper off. And once you start exercising a lot more and it's becoming a little more intense, and you are your marathon runner, you're going to see that oxygen consumption kind of narrow down, or oxygen consumption increase, and your gas tension is going to decrease. So this will respond to your brain by increasing ventilation. So you'll breathe faster and deeper to help compensate for your acid-base imbalance of this acidosis state. So this is basically a respiratory compensation for the acidosis state. Alrighty, slide 7. So oxygen diffusion capacity during exercise. So as you intensify the exercise and your body demands more oxygen, the oxygen diffusion capacity in your lungs will also increase with linearly, can't say this word, with your oxygen consumption. So during maximum exercise, this may even increase to up to 3 times compared to your resting levels. So how does your body pull this off essentially? It will all come down to an increase in cardiac output, which will then lead to a increase of intravascular pressure in the pulmonary artery and the left atrium. And this pressure has 2 effects on the pulmonary capillaries, which it will distend capillaries that were already open but not fully dilated. So partially open pulmonary capillaries. And then it will also open new capillaries that were already ones that were previously closed or unused. So now you have more capillaries that are open and ready to participate in the gas exchange that's going on in the body. So this benefit is that you have more blood flow through the lungs, so therefore there's more alveolar capillary units available, which will provide a greater surface area for oxygen diffusion into pulmonary capillary blood. So this means basically more oxygen can diffuse into the blood. Next up, we have alveolar arterial PO2 difference. So at rest, there's usually a small difference of about 10 torr between the amount of oxygen in the alveoli and the amount that actually makes it into the arterial blood. So it's not exactly 0 because of these 2 reasons. The first one being mismatching of ventilation and perfusion in different parts of the lungs. The second one being a small amount of right to left shunting of blood that will just bypass the alveoli completely. So when we're exercising and you begin to increase your oxygen consumption, both your alveolar ventilation and cardiac output will increase to keep up, but your alveolar arterial pressure of O2 will stay about the same, around 10 torr, until you reach 40% of your maximal oxygen consumption, max VO2. So it will, after that, because your level of exertion, your oxygen is being extracted so rapidly, your blood is moving through your lungs so quickly that it becomes harder to fully oxygenate it. For example, the marathon runner that we keep talking about will be able to have a alveolar arterial difference of about 33 torr at their max effort. So this is a big jump from the 10 to the 33. And this diagram kind of demonstrates the way your PaO2 will increase or stay the same depending on that 40% of your max oxygen consumption. Alrighty, next up is your circulation during exercise. So heavy exercise is one of the most stressful conditions that the circulatory system encounters. So basically what's happening is that your blood flow to the muscles that are working to keep you going will increase as much as 25 times compared to resting levels. And also the cardiac output to get blood flow, the amount of blood your heart will pump will increase 8 times. Sorry about that. And your ability to increase your cardiac output to the muscles is kind of a determination of how long and how tensely your exercise will be sustained. So some physiologic reasons or responses that have to occur in order for your circulatory system to supply the muscles with the needed amount of blood and to keep up. There are three different responses. The first one is sympathetic discharge. So we'll chat more about this in the next slide, but this will trigger things like a faster heart rate and stronger heart contractions. The next one is an increase in cardiac output. So the heart will pump more blood to deliver oxygen nutrients to the muscles. The third one is an increase in arterial blood pressure, which will help push that blood to where it's needed. So more about sympathetic discharge. So at the start of your exercise, your brain is going to send a signal to the vasomotor center in the medulla oblongata. So this will then trigger a sympathetic discharge. So sympathetic discharge, sympathetic nervous system. So the sympathetic discharge has two effects. The first one is your heart is stimulated to beat faster and with more strength, like I previously said. By doing this, this will increase the cardiac output, and this will help get more oxygen, nutrients to the muscles. Second, the blood vessels in your peripheral vascular system, the ones that are supplying the non-working muscles, will constrict. So this will redirect blood flow away.
That's good. And then next we have up is training the heart. Depending on the type of activity that is being performed, will determine how the heart reacts. So instead of sprint type of exercises, if you do endurance training, it will equal to increase cardiac enlargement or increase pumping ability. The athlete's heart is considered a sound heart. It just has a greater stroke volume and a reduced heart rate than regular people. But at rest, we all have the same cardiac output as an athlete of that type. Okay. And then from there, going back to the circulatory functions, the stroke volume during exercise. Going back to old chapters, we talked about stroke volume, and it's the amount of blood ejected from ventricles within each heartbeat. The two factors that cause an increase in stroke volume is vasodilation and sympathetic discharge, which we just discussed. These factors cause for increased venous return to the heart, and it also equals like greater vasodilation equals increased stroke volume. Along with that, we have heart rate. the maximum heart rate equals about 220 minus your age, so that's how much your heart rate should go up to. As heart rate increases, the more heartbeats occur, causing increased cardiac output. When we also discuss heart rate, they have an inverse relationship with stroke volume. So depending on your condition, the more stroke volume you have, it can also decrease your heart rate, but the more heart rate you have, like increased heart rate, it could also decrease your stroke volume. And age is a major factor in the way the body is able to do that. So going back to cardiac output, which is the product of heart rate and stroke volume, the volume of blood the heart pumps in 1 minute. When exercising, more oxygen is needed, so therefore more cardiac output must increase. So either that's through stroke volume or heart rate. And on the side, as shown before, the cardiac output increases as your exercise increases as well, meaning we need more oxygen. So going back to a couple chapters back, the relationship between cardiac output and stroke volume is the Frank-Starling's curve, which means basically increased stroke volume equals increased cardiac output. And yes, and also the reason the heart can't accommodate for all this is the increased cardiac output and stroke volume. So as they increase, the heart is able to expand and contract more often. And then with the heart rate versus stroke volume and increasing cardiac output, stroke volume increases to about 100 milliliters to 150 milliliters, and the heart rate increases from about 50 to 150 beats per minute. During intense exercises, the increase in heart rate resembles a greater portion of the increased cardiac output. When the stroke volume reaches its maximum, the maximum cardiac output is only approximately 50%. In addition to that, cardiac output reaches about 9% of the maximum that can be achieved. So the more exercise there is, stroke volume doesn't go all the way up, but the heart rate it allows for the cardiac output to increase to its maximum. And then the benefits of exercise is improved sleep, reduced cholesterol levels, increased mood and energy, decreased weight, reduced risk of diabetes, reduced stress, and increased intelligence.
Okay, and then next up, we're moving more into the relationship between blood flow. So the body generates most of its heat, or a lot more heat when it's exercising, and this can lead to an increase somewhere around about 20-fold. I know that that was mentioned a little bit before, but most of the blood's body heat dissipates through the skin, and in order to do this, it requires a substantial increase in blood flow to the body surface. So this is typically known as cutaneous blood flow, which is the blood supply um, that goes to the skin, and it's crucial for the thermoregulation and controlled by both sympathetic nervous system and a couple other factors for the skin, with the sympathetic nervous system playing a key role in the vasoconstriction and vasodilation as well. If exercise happens during very hot and humid conditions without ventilated clothing, heat loss can be impaired and large amounts of blood can be distributed to the skin. So this can lead to a rise of body temperature to about 106 degrees Fahrenheit to 108 degrees, as well as much as 5 to 10 pounds of body fluid can be lost in the span of an hour. So this can lead to something called heat stroke. So this is a severe heat illness that results in high and elevated body temperatures along with the following symptoms and signs. So some things to look out for is profuse sweating followed by no sweating, extreme weakness, muscle cramping, exhaustion, nausea, dizziness, confusion, staggering gait, altered level of consciousness, unconsciousness, and circulatory collapse. So because heat stroke can be fatal if not treated immediately, it is important to do things to help prevent avoiding heat exhaustion. So things such as staying hydrated, wearing light-colored, loose-fitting clothing, limiting strenuous activity during the hottest parts of the day, and then seeking shade or air conditioning. And I feel like it's very important for people who are first starting to work out or do like strenuous workouts or even getting into a sport that they've never played before. It's very important to know what to look for and also just to keep in mind keeping their body cool because of how quickly things can heat up, especially if they live in areas where the heat itself can become really extreme places, even California, places such as like Nevada, Arizona, things like that. All right, so moving into recovery. So it takes a while to regulate body temperatures after the cessation of exercise. And there are a few reasons behind this. So one, temperature regulating mechanisms in the body often fail at very high temperatures, and intracellular metabolism is much faster at higher temperatures, which tends to still continue to generate more heat, leading to the continuous rise in body heat itself. So treatment for heat stroke. So these are things going to be such as spraying cool water on the individual, continually sponging these individuals with cool water, blowing air all over the body with a strong fan, and a combination of all three. And then we have a small little image right there that shows some things to do. So another thing would be to make sure that the individual is lying down, so that way their body isn't continuously pumping blood and they're in a more relaxed state. To elevate the feet as well, that kind of helps the blood circulation as well. And then adding in drinking the fluids, even though sometimes you want to kind of just get them to cool down through the spraying of the water on the body and getting it from external into internal. Okay, and then moving on into pulmonary rehabilitation. So pulmonary rehabilitation is a service for patients with chronic obstructive pulmonary disease, also known as COPD. It provides patients with a process of developing and maintaining a desirable level of physical, social, and psychological well-being. And then it is completed through 3 different phases. But then on this image here, it shows a little bit of the components that will be talked about in the next couple slides. So we have psychological support, nutritional advice, outcome assessment, education, general exercise training, and breathing retraining. Okay, so we have, as I mentioned, we have 3 phases. So the first phase is going to start with the patient being in the hospital. So with this, there's a lot of tests and pre-tests that are going to be done for this patient. We're going to find out their pulmonary functions and run those through the studies. And there's going to be stress tests and walking tests to be done to see where they're at in the levels of their heart and everything like that. So they're also evaluated for nutritional, psychological, lifestyle, and vocational needs. So just seeing where they're at in the stage of their life currently, depending on their age, their background, their family history, and how they go about their day-to-day life. So phase 2 is a 10 to 2-week occupational therapy. Patients, so with this, patient and family are going to get special education on how to support themselves and their loved ones through this entire process. They're going to receive group and or individual counseling, and then also group discussion sessions as well. So they're taught cardiopulmonary anatomy and physiology, so a little bit more on how the heart is going to interact with their body, and especially for those with the COPD, learn how that's affecting their body and why it's so important that they get this rehabilitation. They're going to be taught breathing techniques, pulmonary hygiene, get more in depth on nutritional guides, and then they're going to be taught the importance of exercise as well. They're also going to be given a range of motion exercises. So this is like very basic stuff at first. This could be things such as walking, cycling, swimming, or being put on the elliptical trainer. And then the main goal of this phase is conditioning of the cardiovascular system and skeletal muscles with moving to long-term graded exercise. And then a few other things in this phase that can be taught as well, as mentioned before, breathing techniques. These are going to be things such as like pursed lipped breathing, diaphragmatic breathing, and then respiratory muscle training. And then towards working through this phase, and then especially moving into the phase 3, they're going to be taught how to strength train. So a lot of times you'll see, because patients are typically going to be a little bit older, so they're going to be using a lot of things such as resistant bands, light weights, body weight exercises, a lot of shoulder rotation, neck rotations, and then chest stretches as well. And then moving into phase 3, this is going to be where it's going to help patients be more independent and responsible for their own exercise program. So they're going to have lots of follow-up care and long-term maintenance goals um, being examined at this stage. They're going to have improved efforts to modify risk factors. So these are going to be things such as smoking cessations if they're smokers, controlling blood lipids, especially if they're diabetic, and things like that. And then this phase should continue indefinitely. And then that's going to be where they're going to learn more things such as making sure they're stretching, doing specific movements, and then just making sure they're keeping up with the strengthening of their muscles and things like that. Okay, and then moving forward, we have benefits of pulmonary rehabilitation. So pulmonary rehabilitation is going to primarily help you to breathe easier, increase activity tolerance, improve your mood, and also help you stay out of the hospital. So, benefits are going to be exercise capacity is improved, patients' perceived intensity of breathlessness is reduced, health-related quality of life is improved, the number of hospitalizations and days in the hospital are also reduced, anxiety and depression associated with COPD are reduced, strength and endurance training of the upper limbs improve arm functions, and that's going to also help improve the blood circulation as well. Benefits extend well beyond the immediate period of training. So overall, the whole goal of the pulmonary rehabilitation is to help improve overall life function. So with that being said, doing all these things is going to help essentially with their life output and expectations as well. Survival rate is improved. Respiratory muscle training is beneficial, especially when combined with general exercise training. That just is going to help make sure that the muscles are getting the proper oxygen that is needed and help that with the blood flow. And then psychological intervention is helpful as well. And so is becoming educated about COPD and medications that could accommodate with these individuals who have this disease as well.
All right, that concludes our presentation. Hope you learned something.